Hi, this is Nicolette Lambert with Birth Multiverse, and this is our first of 2 lectures on pain medication. Now, there's a little warning and a caveat with this that you're going to need to know more than just whether or not you want an epidural in labor. Even if you're planning to get pain medication, you still need to know about coping techniques, how labor progresses, because you are not going to be able to just walk right into a hospital and say, give me my epidural and and then just wait for your baby. You actually have to be a little further along in labor often before you can get pain medication. And also there are certain benefits and side effects to pain medication in labor. So you can't, it's not a set it and forget it thing. And that's kind of a problem that we have lately is that they've done surveys about childbirth education and whatnot, and how women are approaching it and how they feel about it. And a lot of women say, well, I don't need to take a childbirth class because I'm going to get pain medication. Not the case, because your labor, even if you're having pain medication in labor, knowing how to cope with the pain, how labor progresses can help you to still have a better and safer labor. And you're not going to be able to just walk right in and get pain medication. So with that in mind, we're going to get into this a little bit. Again, I've had 3 natural births. I've never had a medicated labor. However, I believe that every woman needs to have the ability to choose, and she needs to make an informed decision. You need to know what your options are for pain medication and what the benefits and the risks are. So we're going to get in depth into pain medication in labor here. So first of all, the basics. You have 2 types of drugs for pain relief: analgesics and anesthetics. So analgesics lessen pain without the loss of feeling or muscle movement, but anesthetics relieve pain by blocking most of the feeling in your nerves, including the pain. Pain relief medications can be 3 sort of ways: systemic, regional, or local. So systemic medications affect the entire body. Local medications affect only a small area of your body, and then regional medications affect, a region of the body, like a larger part. Typically, with labor, we're talking about below the waist. If you get regional and pain medication labor, that's going to be pretty much everything below the waist. Now, systemic analgesics, they reduce your awareness of pain and they have a calming effect. These medications are also known as opioids. These drugs will not cause you to lose consciousness. And systemic analgesics are usually given as a shot or through an IV line in your arm. Now, side effects and risks of systemic analgesics. So the side effects include itching, nausea, vomiting, feeling drowsy, or having trouble concentrating. Itching is a big one. I've heard a lot of moms complain about is the itching after having some systemic analgesics. Opioids can also affect your baby's breathing and heart rate for a short time. They are drugs. They do pass to the baby. It's something that you need to be aware of. If you get opioid medications in labor, your baby's gonna be drowsier, kind of sleepy, and not quite as alert, and their heart rate might be lower. And all of that kind of drowsiness and whatnot actually can make breastfeeding in the first few hours after birth more difficult. It's not impossible, and there are women who get a pain medication in labor and they breastfeed fine. You just have to be aware that the baby isn't quite as alert when you put him to the breast the first time after having opioid medication. So just something to be aware of, and just kind of work with him. Still put him to the breast, obviously. Put your baby to the breast. Try to get him to latch and do what you can, but they're going to be a little drowsier. Now, another little thing to know is that you may not be able to get systemic analgesics within an hour before delivery. So again, you have to be aware of the timing. If you're too far along, you may not be able to get a systemic analgesic. We're going to talk about, next thing we're going to talk about though is something a little interesting, nitrous oxide. You might remember nitrous oxide from such places as your dentist's office. Nitrous oxide is a tasteless and odorless gas that is often called laughing gas. It's used in smaller concentrations during labor than it is in the dentist's office. So just an FYI, you're not getting the same amount that you would be at a dentist's office. Until 2011, there was only one hospital in the US that offered nitrous oxide during labor. That number has increased to over 100 hospitals and over 50 birthing centers at this point. So it is more common, but it's still a pretty rare option. I wouldn't necessarily count on your local hospital having nitrous oxide. I've heard that it's a little more common in Europe. I remember when I toured the University of California at San Diego's Medical Center, they have nitrous oxide there, and they said that it's a little more common in Europe. Now, what it does is it reduces anxiety and increases your feeling of well-being, and that makes the pain easier to deal with. It doesn't necessarily kill the pain, but it makes it easier to labor. It makes it easier to deal with. Nitrous oxide is mixed with oxygen, and then it's inhaled through a mask. Put the mask up. Now, you have to be the one to hold, you, the mother, have to be the one to hold the mask up yourself. You can't have a family member or a friend or a doula or a nurse or somebody like that do it. This is a safety precaution, because to make sure that you are the one who is kind of controlling how much you're breathing in. So you can't have somebody else do it. You have to be able to hold the mask up yourself. And if you can't hold the mask up yourself, you can't have nitrous oxide. But in general, if your labor is progressing normally, you should be able to hold the mask up and get yourself nitrous oxide. They usually recommend that you begin inhaling 30 seconds before the start of a contraction with nitrous oxide. And you can take, this is another interesting thing about nitrous oxide, you can pretty much take it at any point in labor, or even afterwards. Even after labor. Many women start nitrous oxide in the pushing stage, and some even use it after the birth if they need to have stitches to repair any tearing. Kind of an interesting FYI. Now, nitrous oxide has very few side effects for the mom and the baby. It's actually one of the, I've even heard it kind of said that it's not really classified in the same level of pain medication that your other things are, like your epidural and your systemics and regional and stuff like that. Again, when I was at UCSD touring there, they kind of classified it as being more of a natural comfort measure rather than a medication, because it doesn't affect your body in the same way pain medication does. You can move around with nitrous oxide. It doesn't require any continuous fetal monitoring, and it doesn't seem to affect the baby's heart rate or the mom's contractions. As far as we've been able to tell, your contractions are going to progress normally. Your baby's heart rate is going to be normal if you're using nitrous oxide. And if you have nitrous oxide and you want to use other pain medications, that you can. That is totally an option. And there are a lot of moms, now remember what I said about how you can't just walk up, say, give me my epidural and wait for the baby to come. Well, this is one of those scenarios where nitrous oxide kind of works really well. There are a lot of moms who use nitrous oxide in the earlier stages of labor to help them get over that. And then as they're starting to get closer, then they opt for pain medication. So that's definitely a viable option. Again, you have to hold your own mask. And one side effect is that some women do feel dizzy or nauseated while inhaling nitrous oxide. These sensations usually go away within a few minutes, and it's usually not anything big, and most women actually don't feel that dizziness or nausea with nitrous oxide. And one final note, you will not laugh uncontrollably if you get nitrous oxide during birth. Nitrous oxide just helps you feel more relaxed and happier during the birth, and that's kind of why it's called laughing in gas, is that people sort of feel better, or they have a greater sense of well-being. So that's nitrous oxide. Next thing we're going to talk about is local anesthesia. So local anesthesia is the use of drugs to prevent pain in a small area of the body. So the anesthetic drug is injected into the area around the nerves that carry feeling to the vagina, the vulva, and the perineum. And local anesthetics provide relief from pain in these areas. Drug is also used when an episiotomy needs to be done or when the tissues need to be repaired after childbirth, like stitching after perineal tearing. When it's used to relieve pain during childbirth, the drug is given just before delivery. So there are some side effects and some risks of local anesthesia. Rarely a woman may have an allergic reaction to a local anesthetic, or she may have nerve or heart problems if the dose that is given is too high. And local anesthesia rarely affects the baby. That's one of the nice things about it. Because the baby is so close to delivery, these drugs are given so close to delivery, the baby doesn't have much time to absorb the drug, and it's given just locally. So regional analgesia. Next, we're going to talk a little bit about regional analgesia regional analgesia and regional anesthesia. Okay, so regional analgesia and regional anesthesia are used to lessen or block the pain below the waist. So examples of these include an epidural block, a spinal block, and a spinal epidural or combined spinal epidural, often called CSE, CSE block. So the medication is administered for regional anesthesia or analgesia, and it includes an anesthetic that may be mixed with an opioid analgesic. The medication may be given as a single shot or through a thin tube placed in the lower back. Now, this is going to be the end of our first lecture on this, and our next lecture we're going to get a little more into detail about the big one that everybody gets, or not everybody, but your big pain medication option, and that is the epidural block, and that is our epidural. You know, when women say they're getting an epidural, that's the epidural block. So we're going to talk more detailed on that one in our next lecture, because that is such a popular and common pain medication option. We really want to go into depth in it. So this is kind of a brief overview of some of these. One thing to consider, especially with like your local analgesia, is that if you can push out getting pain medication kind of for as long as possible, that means that there are fewer complications that come for you and for the baby. I have a friend who got pain medication just before the birth of her baby. I mean, it was probably like 10-15 minutes right before, and things were getting really hard on her. And she said it actually worked out great, because when her baby came out, he was alert because he hadn't gotten any of the pain meds or anything. And she really, really liked that as compared to her first two births, where she had more drugs in her system, and her babies were just kind of sleepy. And by the way, she did breastfeed all of her babies, and they did breastfeed well, but she liked how much more alert that her son was as compared to her first two daughters, who were born on more extensive pain medication. So it's something to consider, is maybe consider pain medication being as kind of in your back pocket. And you can look at using other methods of coping with pain to help you get through those earlier stages, and then consider focusing on having pain medication towards the end, because that way there are less problems. There's less problems for the baby, and there's less of a chance of getting that cascade of interventions where your contractions slow down, and then you get Pitocin, and then you need more pain medication because the Pitocin makes things more painful. Just consider not getting pain medication right away as an option. So the next thing we're going to talk about again is epidurals and some other of those regional anesthesia options, and I'll see you for our next lecture.